Namaskar, I'm Ashok Vyas, and this is your own Healthy You and AAPI series. Today, I'm delighted to be welcoming someone who is going to talk about the theme which concerns all of us: lifestyle medicine. Yes. So, what is lifestyle medicine, and why should we look at lifestyle medicine with a different light? And what is that light? We will learn from Dr. Bhoja Kattipalli and what makes him the best person to talk about it. I'll share that in a bit, but let me welcome Dr. Bhoj Kattipalli ji from Texas. Namaste. Welcome.
Namaskar, Ashok ji.
Such a pleasure to have you with us, Dr. Saab, and I must make our viewers also happy by learning that they are interacting with a passionate double board certified physician who is, of course, practicing in San Antonio, Texas. But what makes you special, which brings many awards near you, that includes board certified family physician at the University Health Systems in Texas, and there you have been serving for past 15 years. You are also adjunct assistant clinical professor, medical director for many busy service lines. And of course, you have the experience of having interacted with thousands of patients. While we have many issues concerning us, including obesity and blood pressure and high cholesterol, and everything somewhere seems to have relationship with our lifestyle. So once again, I take this opportunity of thanking you for joining us, and let me request you to open up by sharing the basic idea which you have for lifestyle medicine.
Well, thank you, Ashok ji, for the kind introduction. And we are actually, this is the time. This is the time to kind of make shift in the way we look at the health and the healthcare. And of course, our pandemic, through a huge, a challenge at everyone, not just the patients and the doctors of the healthcare industry, but as we noticed in the past couple of years, the whole world was shaken up and was challenged to kind of do think of something different, the way we execute things. Coming to the lifestyle medicine or the medicine in general, healthcare in general, myself, as you just mentioned in your introduction, been working with the university health system here in San Antonio for quite a good time, for over 12, 15 years. And I think this is the longest period that I ever lived in anywhere, in my life. San Antonio, I love this place, love the patients and the environment. And over this past decade, it's gratifying. Obviously, this is the passion we had and always wanted to be a physician. After learning, a few principles from my grandfather, and then yeah, it was exciting. So I was enjoying my profession and career, and took some of the leadership roles as well. But deep the bottom of my heart, there was something missing. I mean, every day, and I was seeing patients, like any other physicians, 20, 30, 40 patients a day, and keeping ourselves busy, our team busy, and then certainly helping the patients out with what they needed, that we think, as physicians of modern days. But a deeper corner of my heart, I was looking for something that I was missing for years. Over the past decades, in a couple of decades, I think the medical technology has evolved. If you look at the diagnostics and pharmaceuticals and kind of procedures and surgical techniques, there's an explosion. There's an explosion. What we learned in the past century or so was at one side, versus what we invented and introduced into the medical field or healthcare in past couple of decades is mind-boggling.
Yeah. Doctor, if I may interrupt you to share with our viewers that I understand you adopted plant-based lifestyle, and that diet helped you tremendously. What led you to consider switching your other type of diet, which many of us still are subscribing to, which includes what we say fast food, and basically once you are in America, pizza and burger becomes your main idea of eating quick.
Right.
So, talk to me. What led you to consider plant-based diet?
Well, absolutely. I think you're hitting the right point, Ashokji, right there. I mean, that's the kind of, concept or the paradigm we are living in. As you just said, it's nothing new to hear that as you move to West or Western world or America, burgers and pizzas and fast food becomes your staple diet or your go-to option. And unfortunately, it's whatever is happening in US doesn't, and whatever happens in US doesn't stay. Take it technology or any fashion or the food trends. It's actually trickling down across the world. So rest of the world is adapting the same. But the reason I say that's the paradigm, meaning, unfortunately, the definition of culture or the norm is what the majority of community, in the community are following or adapting. That doesn't always necessarily be normal. Norm doesn't need to be normal or actually ideal for us. If you look at the food industry, the revolution that took place in past couple of decades, the way they process the food, produce the food, package, and distribute, and bring it to your table or to your hand, uh,
Yeah.
changed. And then there are a lot of different metrics. I mean, it's a food and the healthcare. Unfortunately, both are actually run as industries, so they have their primary goals, which are far from the health consciousness, basically. And so, out of the necessity, out of convenience, out of their strategic, strategic, business metrics, I believe the food industry took a totally unexpected turn, and then we are there. And then with today's busy lives, force us to look for something convenient and quick, where you don't have to worry about cooking or prepping, and especially if everyone is doing the same around you, you don't even feel like you're doing something wrong or incorrect.
Okay, so if I may share my observation, there were days when you had a tradition at home that you need to eat fresh cooked food. Now we have many families keeping 1 week in the fridge and then eating. Does that also make some effect on our health?
Right. It certainly does. It certainly does. But at least if you're cooking, from scratch, and then storing in your fridge in ideal temperature, conditions, I don't think it's going to do as much harm as a packaged food, which is full of artificial flavors and colors and preservatives. So it's definitely far superior or better. But when it comes to the whole food plant based, as you just kind of wanted me to kind of comment on earlier, that after looking at the food that we are consuming nowadays or addicted to, in other words, I wanted to make a conscious shift, intentionally, because it's not just the preservatives or the artificial those flavors or colors or additives they're adding. There is a lot of extreme level of processing, and the processing doesn't mean that they're taking the rice or the wheat or the grains and just turning it into flour. It's far beyond that. There are so many steps and stages of chemical processing happens. If you look at the plant-based products, meaning vegetarian products, but if you look at the animal-based or the meat products, that's a totally different world. And again, the primary gains are different, for the industry, and then they have to mass produce and mass, process and then package. And then there's so many, chemical interferences and the processes involved. By the time it gets to your table or to for you to kind of consume, it goes through so many chemical changes, and that's not it. That's where it actually begins. Once it enters the human body or digestive system, it disrupts our enzymatic or hormonal system so much that actually our human bodies are going through a metabolic chaos, and that's actually the root cause. I mean, besides the systemic inflammation we always talk about, which is actually a root of majority of the modern diseases that we are seeing or dealing with today.
So, yeah, Doctor, I just feel as a layman,
Mhm.
whatever be the method of medicine adopted by doctor to address the ailment or your heart or whatever problem has taken you to the physician, it would ultimately have a combination of your food intake and the kind of diet that you have, which would help you get cured at a faster or a slower pace. So I guess that is correct, right? To say.
That's absolutely correct. Actually, that's the common ideology or the understanding we had for so many years, and we knew that, it's not an understatement, because when we say, you are what you eat, and we all believe in it. But until there is a groundbreaking research by Dr. T. Colin Campbell in 70s and 80s, who were he was actually sent to China. Actually invited by the Chinese government to undertake a huge, one of the largest, public health study ever. After their leader actually was diagnosed with cancer, and then he wanted to figure out, what's actually playing a role in the the pathophysiology, the underlying process behind this modern disease, especially cancer. So, in short, it was shocking for the research team to discover that there were villages in the rural parts of the China that, out of thousands of autopsies, not even a single person had cardiovascular disease of cancer, and that was mind-boggling. And in the same country compared to the urban cities. So, in a nutshell, that was the groundbreaking observation. And then Dr. Campbell and team actually turned to United States and wanted to look at in our own country or home, which was actually adapting more animal-based, products and industrialization of the food. And it was eye-opening for them, why there are so many chronic non-communicable diseases were actually on the rise in 70s and 80s. So that was one
Yeah.
evidence, and there's so many other research studies, and then people actually pioneers of the lifestyle medicine, invested their decades of lifetime and proved that it's the food that is actually causing, and they have gone to the molecular level, tissue level, and then proved that there are in fact a huge cellular level or hormonal level changes that are actually taking place from the food that we consume.
So, as we always hear, prevention is better than cure. Looks like you are realizing a sense of urgency in making people aware about changing their lifestyle. And lifestyle medicine is overall related to how you conduct yourself with your food intake and all. So, give us a broad picture of the current state of health in the world at large, very briefly, and because that would also help us look at where we are and the kind of urgency which I hear from you in terms of making a paradigm shift in the way healthcare is approached and delivered. So, your
Right,
thoughts?
right. Well, I think the people in this is a fairly a new field. Lifestyle medicine is not a high tech or the groundbreaking, specialty per se. This is nothing but actually a specialty. The group of physicians or the founders wanted to bring the foundational, principles to the practice of medicine. So, just to kind of answer your question, we think the world we are at urgency. I mean, we cannot wait any longer. If you look at the past couple of decades itself, just the US or world at large, thanks to the modern medicine with all the inventions and discoveries of antibiotics and vaccines and so forth, those nutritional malnutrition and infection related deaths, maternal mortality and neonatal mortality, kids and moms dying, are gone. And we were excited that we increased our life expectancy, human life expectancy in the modern world. But unfortunately, that's a misleading metric, because we are living longer but not healthier. We discovered ways to stretch your life. In a nutshell, the modern medicine doesn't let you die. We have enough tools and pills to keep you alive. When it comes to the sense of urgency, in the past couple of the 20, 30 years itself, the rate of obesity and the overweight and obesity in the world skyrocketed, and in the US as well. The diabetes, the cancer, the heart disease. And these are the leading non-communicable diseases. If you look at the leading causes of death, the top 10, 6 to 7, meaning 60 to 70% of the top leading, top 10 causes of death in US and in the world, I believe, are attributed to our lifestyles. It's not a simple statement or something that we can just forget or ignore. And then just the obesity and the diabetes rates are actually doubled in past decade or so. And if you look at the cancer, it used to be there used to be people that you could actually count on your fingertips in past. But you just look around, your friends and family, diabetes, blood pressure, cholesterol, heart disease, people getting heart attacks and bypass surgeries and cancers. It's not unheard of anymore. I mean, it has become part of our life, and then the unfortunate the mindset that we are gone into that it is part of our life. Is everyone as if everyone is destined to get the diabetes or cancer at some point of time, and then there shouldn't be. I mean, there's nothing we can do about. And that is the real sense of urgency. When you juxtapose that with this multi-trillion-dollar industry, we're spending hundreds of billions of dollars for each disease, obesity alone, diabetes alone, cancer alone. It was over $3 trillion budget a couple of years ago, just to take a snapshot. And then 90% of the budget was allocated, actually assigned or distributed towards lifestyle and mental health related conditions. And none of these pills or procedures are actually preventing or even curing these heart disease and diabetes. So we got to find an alternate way, and that alternate way, it's not surprisingly lifestyle medicine.
So, based on what we are learning from you, many of our viewers are also thinking about the myths and misconceptions that we have in our society, and the way we are raising our kids and setting their food priorities. So, talk to me something on those lines, as per your observation, common myths and misconceptions.
Well, I mean, right. I think that's where the actual problem or the challenge is. Our mindsets are attuned to wrong beliefs, because our beliefs and our values and our belief systems are the driving forces behind our choices. Because it's not the knowledge. I mean, everyone knows, that it's the you got to eat, healthy food, and then have regular physical activity and a better sleep and stress management and so forth. It's so we all know what's right and what's wrong, but when it comes to put it to practice, it's difficult, and that's because of our belief systems. And at the root of all that is these misconceptions that diet might not make a difference, because I already got diabetes, and especially the idea that the family history, my mom had it, dad had it, and uncle and aunt and everyone in our family were obese and had diabetes and heart disease, so I can't escape. It's something that I'm unavoidable because I'm born with, right? Just to give you one example, that's the genetic part. I mean, of course, you can't do what kind of genes you got from your parents, right? You can't choose it, the DNA. But there is a concept called epigenetics, and actually, this is picking up a lot of momentum in nowadays. Epigenetics is essentially it's the field of medicine or the genetics that actually looks at how the genes are turned on or turned off, or in other words, expressed or suppressed, either to manifest a disease or to suppress the disease. And the reason I say it's important is one of the strongest misbeliefs that we have in even the physician community, I mean, not just the average patient or common man, that family history plays a huge role that we cannot do anything about. The reason it's important to remember and make shift in your thinking that genes can only carry messages with what you're vulnerable to get, what kind of disease. Those diseases don't get manifested without environmental factor. In other words, Dr. Esselstyn, one of the pioneers of this lifestyle medicine, actually, who is at Cleveland Clinic, running a program for heart disease reversal through this whole food plant-based diet approach. He always says genes would only begin, and your environment actually pulls the trigger. In other words, in my words, genes would load your gun, but it's your behavior or your lifestyle that actually pulls the trigger. Meaning, if you change your diet and lifestyle, there's more than 90% certainty that actually you can either prevent or undo the disease process that
I
you.
think what you just said is quite empowering, and it would, as you already mentioned, would shift the paradigm in a way where you feel more in control and you don't feel that you are trapped because you have certain kind of genes. So I think this is a very, very important point. But looking at your own experience, what are the common challenges that you feel patients face, as well as healthcare professionals are facing today, including how convinced they are about the lifestyle medicine.
Right. So, one of the challenges is adapting or putting into practice, basically. I mean, I don't think anyone is against this idea or approach, but putting into practice is the biggest challenge. Let's talk about the healthcare industry. First, the way we practice the medicine, none of the physicians or the healthcare providers are actually happy about the way we deliver the healthcare services, because there are so many other forces. The way the practices are designed, and there are certain things that we are expected to do. Just to give an example, I mean, there's no enough time for us to physicians or healthcare providers to kind of spend with patients to discuss these lifestyle changes, importance, and how to execute them. And then there are expectations around the documentation or billing and a lot of other non-clinical clerical work. And then if you look at the tools that you have in the modern medicine, the pills and procedures, they hijack the way we execute our functions, our duties. It's easy to write a prescription, or in other words, the way the modern medicine works is you find the ill, write a pill, send a bill. That's simple, and that saves everyone's time. But who wins? No one wins in that game. It's challenging to bring that in. So that's why I think that this field is evolving. Where in the field of lifestyle medicine, if you're interested, you can reach out to your primary care physicians, or you can look up online for lifestyle medicine physicians in your neighborhood or the region, because we dedicate extra time. Not to talk about what kind of pills or prescription that you can walk out with, but what kind of lifestyle changes you can adapt into.
Is there some additional kind of a branch formally dedicated to study lifestyle medicine? That is part A of my question. And then, secondly, there are some observations you make based on your own experience with the patients. And there is a study which kind of gives you pointers as to these are the evidence which would further convince others about the scope of lifestyle medicine.
Well, there's a lot of evidence. In other words, these principles or ideas are not new. I mean, people have been practicing. There is something called in the blue zones in the study, a huge study. There are about 5 regions in the world that they studied. People actually lived beyond 100 years of age without these so-called modern diseases. And one of the key factors is actually the lifestyle. I mean, they're not completely vegetarian or plant-based, but their plant predominant, eating habits and the regular activity, and then their social networking and stress management and so forth. So that's one, that was a beginning point in time, if you look at the lifestyle medicine movement. But a lot of researchers, if you look at Dr. Dean Ornish's research in California, who's actually, his program is the only program that CMS, Medicare and Medicaid, approved cardiac, intensive cardiac rehab program, where the reversal of that heart disease that they work on. And Dr. Esselstyn, the program at Cleveland Clinic, that's a highly regarded program as well for the reversal of the heart disease. Dr. McDougall is out there, and then there are lots of physicians. If you look at Dr. Neil Bernard, who's actually founder of the Physicians Committee for Responsible Medicine, there's a lot of research as well that they have an advocacy group fighting for these changes in the healthcare, because the billing and documentation and having proper realigning the practice of medicine to promote the lifestyle medicine.
If anybody wants to be a part of this lifestyle medicine movement, what is the way?
Well, yeah, that's true. I'm definitely excited, more than excited about this transition in current healthcare system, because more and more physicians are actually leaning into this. Not just the primary care physicians like internists or family physicians. There is an growing number of specialties, cardiologists, endocrinologists, and the skin and rheumatologists. You name it, actually, even surgeons. Some of the surgeons are actually getting into this field, excited about this, what lifestyle medicine can do for their patients, after having their personal experiences as well. So the real hope is in both directions. Actually, in the healthcare, there are lots of physicians and the leaders, fighting for this, to bring into the mainstream practice. If you go to American College of Lifestyle Medicine, if you're one of the healthcare professionals, look into that, the resources, and then you can get board certified. If you're in US, by American Board of Lifestyle Medicine, or International Board of Lifestyle Medicine if you're outside. And then see, who is actually practicing in your town or in region, and then interact with them and see how you can adapt this kind of practice. If you look at from the patient perspective, I'm sure you can actually see that in the mainstream food industry as well. Every restaurant, including fast food restaurants, actually, they're racing to bring at least one vegan product. The vegan, unfortunately, it's not doesn't always equate with whole food plant based, but at least it fulfills the first half, meaning going away from the animal based products, meaning meat, egg, poultry, and milk. So food industry is adapting.
Yeah, so Dr. Boy, I'm just reminded of the International Day of Yoga that is observed on 21st June, initiative or sort of proposed by Prime Minister of India, Narendra Modi. Now, do you see yoga becoming very popular in several countries? Is also something resonating with the lifestyle medicine that
Absolutely.
we are talking about?
Absolutely. I mean, yoga and meditation, all these, we call, ancient practices. There are lots of other Asian practices, beyond yoga and meditation itself, but they are a part of the lifestyle medicine as well, because those are the tools that we recommend to our patients. They fall under stress management or self-care, which is really essential. It's not just about feeling good. That feeling has tremendous hormonal implications and pathways underlying. It does play a key role in your inflammation and the disease process as well. So please do look into that. And actually, it is. It's not unheard of. I mean, it's on the rise, and then people are adapting it, and there are yoga therapists, and then the centers opening. As a matter of fact, at our upcoming 40th AAPI convention here in San Antonio, led by Dr. Jay Shah, who's the chair of the convention, and Dr. Anupama Gautamukula, president of AAPI. We're actually hosting a wellness package and wellness program as well, inviting the leaders in the yoga and meditation field, and lifestyle medicine speakers as well.
So, Dr. Bhojbal, I thank you, and I look forward to having more interactions with you, because I think there are many important areas which our viewers should learn about as far as lifestyle medicine is concerned. In 10 seconds, if you are to conclude, what would you say?
Well, all I can say is there is a power. There is a proven literature. What lifestyle medicine recommends is actually it's evidence-based lifestyle interventions to prevent, manage, and even potentially reverse most of the chronic diseases. So it's not just a feel-good approach. There is a growing body of evidence and research to support
Wonderful.
the interventions.
Wonderful.
So
Yes.
look into that and look for a lifestyle medicine and practitioner in your region, and see what it can do for your health.
Thank you very much, Dr. Boj, joining us from San Antonio, Texas, sharing all about lifestyle medicine. Thanking Dr. Boj, and thanking all of you for being a part of this conversation. This is Ashok Vyas, signing off from this edition of Healthy You and API. Namaste.
Thank you.